Today we have gathered to see about acute GBS management in ICU care for the acute stage. Okay, here we are seeing the patient of descending GBS. Normally GBS, it is a ascending type, means lower limb start the weakness and progress to upper extremities. But here in the descending GBS, it is a rare variant of GBS where you find descending weakness. It means the weakness starts from the upper limb and hands and facial muscles, progresses to respiratory muscles and descending down to the other limb muscles. So here descending GBS also having the features of Miller-Fisher syndrome. In that Miller-Fisher syndrome, you find the main three symptoms. First is the facial muscle weakness. Second is the stage of ataxia, means lack of coordination. Third is the ophthalmoplegia, means eye muscles weakness or paralysis. And third one is called, it as a patient has a severe respiratory weakness also. Okay, so this is a type of the Fisher-Miller syndrome. Okay, where we find this case. So here is the case of the same. Okay, we have all seen in the first part of the treatment. Okay, what we have started with the exercises in ICU. Now today we are seeing the second part after 10 days of the gap. Now we'll see the what are the exercise we are going to now. Okay, in this present status. Yes. Each kitty 2 0 9 20 age of the girl. Okay, yes. We see the hand movement. Muthi maro. Yes, very good. Relax. You can see the upper extremity hand muscle weakness. Yes. Atma mar beta. See, one that is better than the other. We have to see the parameters also. Last time we have seen whatever the exercise we give. Okay, we have to go to the parameters. SpO2, heart rate. Okay, respiratory rate. All are normal. Then according to that we have to progress. Very important thing is that compared to the last video, she has removed the ventilator. So already she is the wean the ventilator, not even on oxygen. She's only on ET tube. So that is a progress we find in last 10 days of hard work of physiotherapy and her effort also. So next we are progressing. Heart में weakness है, कमजोरी है. Okay, so what we do, we have to facilitate the muscles which are stronger. ये thumb to hand fingers touch करो. Is able to attempt but not able to give the force against resistance. So उसमें हम क्या करेंगे, पकड़ के उनको बोलेंगे अभी आप ट्राई करो नजदीक लेने का. Yes, and I am applying the resistance in the whatever the range and strength available. So जो भी strength available है उसको पकड़ के हम resistance देंगे. Second finger. और पहले भी बताया था ये पेशेंट फैटिकेबल होता है, very easily to fatigue. So उसमें आपको ट्रीटमेंट ऐसे ही करना है with the circuit training, pace training in between, giving the relaxation and breathing exercise. Very good. Third finger पे लो. Yes, try. Yes, try to go. Yes, try to go. Very good. Try to go. Yeah. Very good. Yes, last finger. We have to try in all the fingers. Try. Yes. First of all, we have to get the thumb muscle strength because thumb is the head of the hand. So if the thumb is working properly, then all the fingers also works well by supporting the thumb. Because anything you want to hold, you need a thumb support for the finger. Possibly we have to do all functional exercise. Okay, that helps to do some functional activity. Relax. Next, we'll tell her, okay, try to do extension. Yes, you can see that insufficiency principle. When it's trying to do extension, finger flexes. Go down, do the flexion. Yes, try to do the extension. You can see the wrist has some power compared to the fingers. Very good. This is typical symptoms of Miller-Fisher syndrome or descending type of variant of GBS. Go down. But that is going to be recovered. It may take around weeks to months, but it is 100% recoverable. Go down. So we have to facilitate the tone. You know that wrist extension is working well compared to finger extension. So what we do, here we apply the resistance to the wrist extension. Try to go up. You see, the finger are extending. Yes, that's we want. This is called principle of irradiation in the PNF. Relax. Okay. Again, come up. When she was doing wrist extension, finger was going in the flexion. To facilitate the finger extension, with the wrist extension, we have to do this PNF irradiation principle. In that, we are applying the resistance to the stronger wrist extensors. ऊपर करो, wrist extension, try करो, wrist cup, up, and we are applying the resistance what the way she can tolerate. Yes, that facilitate the finger extension. ऐसे करके उनको फिंगर एक्सटेंशन हमको डेवलप करना है. ऊपर करो. यस यस यस. देखा ऊपर जाने के बाद अभी फिंगर फ्लेक्शन में जा रहा है. उसको धीरे धीरे प्रैक्टिस करने से अवॉइड हो जाएगा. अप करो. वेरी गुड. अप. Yeah, relax. Okay, so finger extension is very important component. The next component is our fisting. So fist making, yes. In that we will apply the resistance. One thumb opposite to the thumb, another two fingers in the fingers, and we tell them to take the fingers towards the thumb and thumb towards the fingers, and we apply the resistance as the patient can tolerate. Yes. Very good. Try. Yes, try. Yes, try. You can see all the hand muscles also in the stage of the atrophy started, but we can prevent it with this all isometric exercise. We will not allow the muscles to go for atrophy because we are doing exercise every 2 hours as per her effort and strength. Very good. Very good. Yes. The next. Now it is not possible to do the finger abduction or adduction because still we are working on the flexion and extension. That muscles will come later on. So next we will take on the, after the wrist, we will take on the elbow. So what the simple elbow flexion extension does not help in the patients with the neurological condition. So we always prefer to go for the PNF. So here we see the elbow PNF, what we see in the last video also. Taking the hand towards the mouth and pronating and taking the hand back to the bed. Taking the hand towards the mouth. She is efforting. I am resisting in the available strength. She has a good strength while going back compared to coming up. So whenever there is a lack of the strength, we assist. When there is a strength, we resist. So during the range, whatever the range is able to do, we resist. Whatever the range she is not able to do, we assist. Yes, rotate and wrist extension, supination, wrist flexion, hands towards the mouth. Yes, very good. Take the hand to the mouth. Yes. Very good. So next movement we take, it is a shoulder abduction in the short lever. Always use the short lever when the patient has the weakness, because in the long lever it efforts a lot for the patient. Take the hand to the abductor position, side position. Yes, and now take the elbow towards your chest, means adductor position. She efforts well in adductor position where the effort is less in abductor. So in abductor we assist where she required, but it should not be passive. Please remember, never do any passive. Always do assisted. When there is a strength, do resisted. Very good. Go in. She's trying to do elbow extension because her elbow extension are good strength. While doing the abduction, she's trying to do elbow extension, but we are preventing it and making the effort to directly only abductor. Yes. So after that, relax, take a breath. We allow them to do normal breath. We see the parameters, all normal. Okay, then we go ahead. Now again, next exercise, it is an internal and external rotation, but not simple internal rotation. External rotation with the supination, internal rotation again with the pronation. Go to the external rotation, hand up with the supinated, hand down, this is pronated. This already we have taught in the first video. Yes, down, pronated, up, supinate. Yes, down, pronated, up, supinated. Yes, These rotations are very important to strengthen the multiple muscles in a one shot. Yes, up. Very good. Therefore, we use the rotation always in our neuro exercise because it helps to strengthen the multiple muscles in one strength. That helps the patient saving the patient energy. Next exercise, we tell her to go for the horizontal shoulder flexion. In that, we will assist whenever they require. We have to make the patient effort. Try to go up, 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 up. You can see her effort. She is going brick way. Yes. Now going down. Take it down. Elbow to the down. Yes. Take it down. नीचे 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 धक्का मारो मारो धक्का मारो मारो. She has a good strength by taking the horizontal shoulder abduction, but she has a weak in horizontal shoulder flexion and adduction. Now go down down. As per her strength, we have to again give resistance to the stronger, assistance to the weak. Please remember this principle. Go up 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 up. We are just handing. She is doing the movement. We are just simply lightly assisting. Go down, 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 down. Very good. Next stage exercise, the same. Shoulder in, so forearm in pronation, shoulder in lateral flexion of 45 degree. You should not go beyond 90 degree because there's a chance of subluxation. So in this range, we have to do the shoulder retraction, okay, and she has to do the shoulder protraction. In the protraction, we are applying the resistance with the joint compression technique. Yes, I'm giving the compression with the wrist, elbow, shoulder, and I'm asking the patient to do the protraction. Push me. Yeah, push me. Very good. Push me. Push me. Very good. Push me. Yes, push me. This helps to get the stability of the scapula. So this exercise also you have to start in the initial stage. Very good. Relax. The next also we have to strengthen the accessory muscles of the respiration. Okay. So for that we make the patient shoulder straight. That also we have taught in the first video. Okay. Now take the shoulder up, elevation, and we are adjusting here. And my starting position is the shoulder distracted position. She is doing the shoulder elevation. Shoulder elevator, the muscles we helps in the respiration. When the primary muscles are weak, you have to strengthen the secondary muscles as well of the respiration. This is the old technique we use so many. Therefore, she is out of the ventilator now. Very good. Relax. The next, we have to apply the very important technique of PNF, D1, D2 flexion pattern. So what will we start with the, okay, first about outer flexion pattern D1. Okay, what will tell the patients? Okay, here it is the initial position, as we all know, the compressed joint compressor technique, and ask the patient to go take the shoulder up, rotate your hand up, out, out, go up, up, up and out, 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 out. Very good. While coming back, we have to give distraction. While going up, compression on all the joints, wrist, elbow, shoulder. Now taking the hand up, rotate your hand out and up, take your shoulder up, 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 up. Our joints are compressed in all the joints. Now relax. Again, she is efforting. We have to guide the movement. Yes, slowly taking the up, 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 up. Relax. Same way, we have to go for D2. Okay, here starting position is the pronated positions. Wrist is a flexion, elbow extension. Okay, shoulder in abduction and extension. Now take the hand up. Rotate your hand towards your face. Okay, take the shoulder up. Take your hand up, 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 up and down, up and down, up and down. Yes, very good. Yeah. Okay, again. Take the hand up, in, rotate your hand towards your face. Take the hand down, down, shoulder up, 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 up. Yeah, she's efforting. So at that time, we have to give resistance. Whatever the range, she's not efforting, we have to do assistance. But we have to make the patient's muscle to contract. It should not be passive at all. We have to make her to contract the muscles as we require. So this is very much important PNF technique. Go up, 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 take your hand, yes, towards your shoulder, 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 take it down, 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 down. Yes, very good. Relax. So these are the all exercise we have seen. Okay. Along with that, we also see the exercise for the breathing in between to facilitate the respiratory muscles along with the exercise, because you have to take care of the vital parameters. So there's technique we have seen also in the last video, that is should be the part of everyday treatment. Our hands, okay, over the lower lateral ribs region, okay, thumb in the front. Yes, okay. Now ask the patient to do inspiration. We have to apply gentle resistance. Expiration, at the end of the expiration, downward inward stretch. Inspiration, mild resistance as the patient can afford. Expiration, at the end of the expiration, downward inward stretch. Inspiration, yes, at the end of the expiration, downward inward stretch. Okay, that helps to improve the respiration. Facilitate the breathing muscles. Downward inward stretch. This is very important, that you have to give the 4 to 5 to 10 repetitions. Slowly downward inward stretch. Same way we have to do, okay, for the chest muscles. Okay, same. Okay, just below the neck we have to apply the hand. Okay, and tell the patient to do the inspiration. While she's doing the inspiration, I am resisting. At the expiration, okay, we are giving stretch. Inspiration, we are resisting. The expiration, we are giving stretch. Inspiration, resisting. Expiration, we are giving stretch. Inspiration, resistance. Expiration, we are giving stretch. You can give the elevation of the 30 to 40 degree or 45 degree to the upper tongue for this position. Relax. Same way we apply on the upper lobe. For upper lobe, we make the patient elevate. Yes, this is a semi-forward position. Now we put the both our upper hand. Last time we have taught to the middle phalanx. Hand over the about the clavicle. Okay, on the upper lobe. Now tell the patient to do the inspiration. And do the expiration. Expiration, we have to give downward inward stretch. The hand is on the apical lobe of the lungs, above the clavicle. Yes. Then expiration. Yes. You can see this effort of the patient without ventilator. She is efforting very well, because we have already done the respiratory muscles and breathing muscle strengthening. So this out of this ventilator. And I told you before also, Miller-Fisher syndrome, descending type of variant of GBS. We have the speech problem, swallowing problem, ataxia, respiratory muscles weakness. Okay. Relax. Up. Relax. Very good. Okay. So in between the exercise, we did the breathing exercise. So our respiration level is very good. You can see the SpO2 level, heart rate level, respiratory rate level. So all are within the limit. Okay. So after that, in between we have to give rest, let the parameters become normal, and then we have to start the next exercise. Now respiratory rate is, yeah, decreasing slowly. Yeah, 96, 95. Yes, so it decreasing. It means patient getting relaxed. 93. Yes, it means patient has relaxed. 92, 89, 88. See, so in between, if you give the rest, the respiratory rate becomes normal. Heart rate becomes normal. So this is an indication. Now we can start with the next exercise. So next exercise we have seen in her. Okay, while we make her patients sit to more vertical. Yes. Okay. And we remove the pillow. Yes. Now we work on the more proximal muscles. Okay. We tell patient for the neck control. Take your neck up. Try to touch here. And try to touch here. Yes, you can see the neck muscle weakness still. Okay, so how to facilitate the neck muscles? Okay, because we know it is a descending type. So here we will apply the resistance over the back of the hand and tell the patient to push back. Yes, yes, push back. These are the gravity muscles. They are always stronger in the GBS patient. So we have to take the help of the gravity stronger muscles. Yes, to facilitate the anti-gravity muscles. While applying the gentle resistance to the neck extensors. Yes, to develop the tone and neck control. Yes. Now try to take up, up, up. Yes, up. Very good. Up. Yes, very good. Up. So slowly, so gradually, neck flexion with the assisted range. Very good. Take up. Very good. Take your head up. Very good. Take your head up. Very good. Okay, so this is the way how we facilitate. Next, ear to shoulder, side flexion. Again, she is able to do in moderate resistance with the moderate, so we have to apply that resistance. Never allow the active movements which is stronger. Always apply the gentle resistance, or resistance can be taken by the patient. Slowly, very good. Slowly, very good. Slowly, very good. Slowly, very good. Relax. Take the normal breath. The neck muscles also helps to develop the respiratory muscle strength, because these all muscles are also assisting the respiration. So next, this side ear to shoulder. Yes, our hand is on the side. Yeah, very good. Yeah, go to the right side, ear to shoulder. Yes, patient is attempting. She is good on that side of range, strength, both. So we are applying resistance in that manner. So whichever range is strong, whichever range of the muscle is very stronger, muscles are stronger, don't leave that muscles, use that muscles, resist that muscles, get the strength of the other muscles. You can use multiple techniques of PNF in this. Very good. Relax. Breathing. Very good. The respiration becomes higher. Okay, you can see the heart rate. Yeah, therefore we have stopped to make the heart rate to get normal. Yeah, it's decreasing very fast from 111 to now it is less than 100. Okay, so now we can start with the next exercise. It is a rotations that also we have taught in the last video. Chin to shoulder. Yes, very good. Rotate. Yes, very good. Rotate. Yes, very good. Rotate. Yes, rotate. Yes, rotate. Very good. Rotate. Relax. Breathing. Normal breathe. Yes. Okay. Now opposite side rotations. Yes. Go to rotate. Very good. Rotate. Yeah. She is rotating and we are applying the gentle resistance as per her effort. Yes. Rotate. Relax. This is a neck exercise we make her to do. Okay. So next exercise we see in while sitting in a 90-degree position. Fully seated. Yes. Okay, fine. In this position, we make the patient to sit properly. Make a cross leg. Yes, we make our patient to sit cross leg sitting. Okay. Now we apply, we give the desk to them, table to them, okay, for doing the exercise. We have to take this table to the level of the elbow 90 degree. Now we are moving towards the trunk and abdomen muscles. Yes, this is the level of the elbow 90 degree. So now This left side is more weaker than right. Right hand you can see she is putting herself. Left side we have to give some support. Yes, both the way. Okay, now we are holding the patient's hand and we commanding the patient to come forward. Yeah, try to come forward. Yes, very good. Okay, fine. Now you can maintain. Yes, good. With the mild hand support, she is maintaining. Good. Okay, fine. Again, go back slowly. Yes. Relax. These are big muscles we are using of the trunk and abdomen. They are very big muscles. They give lots of effort to the patient with having this respiratory rate higher. So you have to again wait for the respiratory rate and heart rate to come down. Yes, good. Because they are using the larger muscles. More larger muscles the patient use, they give the more effort and more energy. They strains the our respiratory muscles a lot. Yeah, now you can see the parameters. Yes, it has gone to normal. Respiratory rate is also normal. Heart rate is also below 90. Okay. Yeah, now we can progress. Okay, next. Okay, again try to come up. Yes, come up, up, up. See, patient efforting well. Try to come up. Yes, good. Very good. Try to come up. Yes, good. Try to come up. Yes, good. Try to come up. Yes, you see, patient is efforting very well. In this position, we will apply powder. Yes. We give the some trunk facilitation techniques on the back. Okay, here we apply the just a normal powder. Okay, applying on the center of the trunk, paraspinal, and we give the facilitations from proximal to distal to facilitate the trunk muscles. Fast stroking from paraspinal region. Okay, even tap. And now we also apply PNF resistance. Okay, to get the tongue control. How to get the upper tongue control? We have also taught in the last video. Same exercise still continue because patient has not developed still full tongue control. Okay, now neck extension. She is able to do neck extension. We already know neck extensions are strong. So we are giving the resistance to the neck extension. Okay, and facilitating the upper tongue extensors. Again, principle of PNF. Yes, take the head back. Yes, give the resistance. Hold it, hold it, hold it, hold it, hold it, hold it. Relax. Again, hold it, hold it, hold it, hold it. Relax. Again, hold it, hold it, hold it. Relax. Same way, we can also give PNF to the upper tongue muscle to develop the lower tongue muscles. So in that, we will do. Tell the patient we hand over the back side of the shoulder, both the hands. Now tell the patient to go back. Yes. Go back. Yeah, go back. So it's trying to go back and I'm getting the resistance from the back side of the shoulder, scapular region. Go back. So that also helps to develop the strength or facilitate the tone of the lower back trunk extensors muscles. Very good. Giving the resistance to the upper tongue muscles and developing or facilitating the tone and strength both of the lower trunk extensors muscles. Relax. Okay. Now relax. In between, we have to give the rest also. Now we tell to go for very important exercise of the face. Okay, we already seen the facial muscle weakness. It is also prominent feature of the descending GBS. Okay, try to look up. Yes, close your eyes. Yes, you can see this is able to close the eyes but not tightly. Okay, make the balloon. Yeah, try to do the Bakshida movement. Blow. Very good. Okay, move your lips. Yeah, you can see she is able to move the jaw. Okay, lips movement weak. Okay, now do the pouch movement. Very good. This is typical feature of, okay, yes. Now try to do the opening the mouth. See, this muscles of mastications are good. Opening the mouth, taking the mouth, deviate the mouth, open and deviate. See, all muscles of mastications are good. Okay, but facial muscle, expressive muscles are weak. This is a typical features of facial muscle weakness. Facial muscle weakness, along with the swallowing muscle weakness and the speech disturbance, it is a feature of descending GBS. So, this all symptoms are present, but it's all are 100% curable with the treatment. So, what we do for that now, for the swallowing muscles weakness, okay, we will apply straw. Yes. Okay, every time we use new straw for the patient. Yes. API. Sister, amnest suction, oral. Okay. Yeah, no problem. Every time we use the straw, very new one straw. Okay, don't use the straw which is already used, because it's already case of the infective. Okay, it is a case of the autoimmunity deficiency, where the patient has some of the infection in the body and that has led to this disease. Okay, so always use the fresh one. Okay, what we'll do, glass water. Okay, yes. આમાં પાણી લઈ આવો છો ને માસી, થોડુંક ધોઈને લાવજો. Yeah. Okay, we will use, तो डेमोस्ट्रेट करेंगे पेशेंट को. जब भी पेशेंट को ऐसा ओरल सक्शन आता है, तब हम जैसे मुंह में सलाइवा आया, okay, we can able to swallow the saliva, but the patient is not able to swallow saliva. So we have to do this oral suction for the patient to remove the saliva, because it's not able to engulf the saliva. Okay, there is a case of this dysphagia, this we can call it as, or swallowing difficulty. So in this patient, we use the straw. We can also use the light things like we have used a paper straw, or you can use the plastic straw, which is not irritable or not damaging the patient. So this all type of technique we have to use to develop the swallow. तो भी swallowing technique में हम क्या करेंगे? Swallowing technique में हम उनको टंग मसल को स्ट्रॉन्ग करेंगे, टंग मसल को स्ट्रेंथन करेंगे. तो वो कैसे करेंगे? पेशेंट के करो यस. Patient open mouth, take your tongue out. You can see the difference. The first video we have seen, patient is not able to take the tongue out in between the teeth. Okay, now you can see his toe is totally out, outside the lip. You can see very closely. You can see very closely. Yes. Now we are doing the subgluteal suction. So she has some cough over there also. Okay, so this is the drastic improvement in the tongue movement. In the 1 week, you have seen that. Okay, initially the tongue movement was very weak. She was not able to move the tongue also inside the mouth. Now it's able to do full tongue out, outside the lip level. There is an improvement. This always improves with the well. Okay, with the treatment. So if your treatment is perfect, you can have a better outcome. So what we have done for the tongue muscles last time, if you have gone through them, we have done the strengthening of the tongue muscles by applying our finger, and we have asked the patient to do the resist my finger and do the trunk protrude the tongue. We protrude the tongue and we have given the resistance with the finger. That technique we have used. Even for the lateral tongue movement also, we have applied the resistance with the finger, with the glove finger. Okay, that also technique we have done. Another technique also we had applied in the last video. It is a rotating the tongue on the both the direction in the level, whatever she can do. That also we have done. Another technique, we have grabbed the tongue in between our finger and thumb, and we have told the patient to do retraction of the tongue, like that, retraction of the tongue muscles. Okay, that already we have seen these techniques. Okay, now we see the next technique here. Okay, what we do is very important technique. If we have transparent straw, then you can see it very visibly. clean. Okay, it's already visibly. Okay, we have to take the water in the cup in only 25% to 30%, not full cup of the water. Okay, and yes, and what we do, we have to ask the patient, okay, to blow inside the water by using the straw. So whenever she is blowing, we cannot judge the how much amount of the air she is blowing with the straw. So what we do, we for visualization of the patient, or we can call it a biofeedback of the patient, how much I am blowing. For that feedback is very important for the patient to develop the confidence in her. So we are making the patient to blow inside the straw, inside the glass of water, and we will see the how much we can blow. We can see the in the form of the bubbles inside the glass. Okay, so that technique helps a very lot in this patient. If the straw is transparent, I will send you the video of the straw also. With the transparent straw, this exercise was done. So in that also you can see how much the patient is taking the suck. So next exercise after the blow, it is a sucking exercise. We'll tell the patient to suck from the straw, okay, and hold the water in between the straw. Don't have to take the water inside the mouth. Okay, she has to suck, take the water up and hold in between the straw at some level, like here or here or here. Okay, how much the proximal he can go, and she has to hold the water in the upper straw level. Don't allow the water to go down again. Okay, so that suck strengthening exercise. The sucking strengthening exercise also very important, because sucking and swallowing both are difficult or weak in this patient. So that will help to develop the engulfing the air or engulfing the saliva, or later on she can have a food also, semi-solid food. We can start with that. Okay, after she having the some swallowing reflex. So this technique is very important. First technique I told you about the blowing. Second technique is about the sucking. Okay, sucking, but not till you have to take the water to the till the level of the mouth. Only till the level of the in between the straw and holding that level. Okay, that also video I will share you later. Okay, we have already recorded with the transparent straw. Now we see the first exercise here, blowing exercise. Wipe kar do. Yes. So these all techniques can be done at the ICU setup also. Okay, don't wait the patient to come out of the ICU and to start the exercise, because the soon the exercise starts, patient recovers very fast. If you be a late in the treatment, the recovery will be very late. So as the patient allows, immediately, or the doctor allows us, immediately now vitals are normal, you can go ahead. We have to make patient upright. Upright patient is very important to maintain the vital health of the patient. अगर पेशेंट लेटा रहता है, बेड में ही पड़ा रहता है, कभी बैठता नहीं है, स्पाइन का वेट बेरिंग नहीं कर रहा है, ट्रंक का बैलेंस नहीं कर रहा है, the recovery will be very late. Okay, fine. She had the cuff, so she are removing the cuff, and we are doing the all the suctioning process. Okay, therefore we are discussing all the next techniques. Okay, so soon we start with the next technique of the blowing with the on the patient. Okay, after this blowing and sucking exercise, also to start with the bilateral manual dual task activities of the hand. That also we will demonstrate today. How to develop the strength of the, you already know, left side of the hand is weak than compared to the right hand. So how to facilitate the left side of the hand, or and encouraging the muscles of the left side of the hand. Okay, that also we will see now. Okay, in the next exercise after this trapeze muscle exercise. Okay, fine. Yes, कर लो. Okay. मोढाનું લચીતા જરા. सक्शन करे, सक्शन कर लो. Yes, fine. Okay, we can after this straw also having the different diameters. Okay, that's also very important. Don't take the simply any straw. मीन नारियल पानी की स्ट्रो आती है, कोल्ड ड्रिंक की स्ट्रो आती है, वो हमको नहीं लेना है. इनिशियल स्टेज में हमको ऐसे लार्ज डायमीटर वाली स्ट्रो लेनी है. ओके, हो सके तो प्लास्टिक की लो या तो पेपर की लो, and that is also which is a throw. Okay, it is has to be used only once and has to be discarded. Okay, तो स्ट्रो का डायमीटर भी हमको स्टार्टिंग में लंबा रखना है. अभी देखना पेशेंट का ग्रिप नहीं है, फेस में लिप्स के बीच में ग्रिप नहीं है, तो भी हम पेशेंट को कैसे ये ब्लोइंग करवा रहे हैं विदाउट ग्रिप ऑफ द अपर लिप मसल्स और लिप मसल्स, कैसे हम ब्लो करवा रहे हैं, वो टेक्निक आपको देखना बहुत इंपॉर्टेंट है। पेशेंट इसको ग्रास्प करके होल्ड नहीं कर पाएगा बिकॉज डज नॉट हैव दैट स्ट्रेंथ ऑफ द लिप मसल्स टू होल्ड properly or make a pouch like this properly. So see how we are making that. It's clear? Comfortable? Yes. Sister, आप पकड़ो ना ग्लास जरा, ओके नजीक लाओ जो, ओके થોડુંક નીચું રાખજો, ઓકે fine. Now you can see closely, okay, we are telling the patient આમ રાખજો, okay, you can see inside the glass also. First you can have the watch over here over the lips, okay, you can see the lips. Yes, we are making the store between the lips. The store should not go beyond the teeth level, otherwise they will squeeze it. Okay, we have to take the store till the lip level only. Yes, and we tell the patient to grasp the store between your lips, you can see, and blow. You can see here, blow. So it's not able to blow, you can see here, fine. So what the technique we will use in this type of patient, we will apply the both side of the lips except this toe area, close it passively. Yes, okay, તમે આ સ્ટોને પકડજો. Yes, okay, now blow. Yes, you can see the bubbles inside this glass. થોડુંક ઊંચું રાખો, नीचे रखो, हाँ, blow. Yes, you can see now properly, blow. Yes, yes, you can see air bubbles inside the glass. How Miss is making the blow, because we have closed the both the sides of the lips, so the air goes only through the straw. Very good. So this is the exercise we can do for the blowing, so we can take the cough or saliva out. Okay, that's very important blowing exercise. Same way we can go for the sucking exercise. Cough. Yes, fine. The same way we can go for the sucking exercise. Okay, see I had some cough in the trachea, so they are doing suction. Okay, so we start with the next sucking exercise. The blowing muscles, what is important? The blowing muscle. Expiration, always we know expiration is more important than the inspiration. More the patient do expiration, CO2 goes more out compared to inspiration, right? So expiration muscles, expirative muscles are very important because it is called forced expirative volume. It improves that FEV1 level, so that helps to get the next inspirative level better. Okay, so we now we just see the next exercise of the sucking exercise. નથી સબગ્લુટિયલમાં, માઉથમાં છે, ઓરલ સેક્શન બી લઈ લો. વેરી ગુડ. See the patient in the ICU having the in between cough secretions, we have to do that vital things before our physiotherapy or in between our physiotherapy. Saliva, okay, that also not able to patient engulfed by the patient fully. Okay, therefore we can tell is that the still pharyngeal muscles, swallowing muscles, sucking muscles are weak. Okay, so we have to develop the strength of that also along with our exercise. Okay, now we go to the next exercise. Sister Pakarjo. Okay, of sucking. Yes, we can see that closely. Yes, 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 fine. Now we have seen the blowing exercise, that was very important. Unfortunately today we do not have that transparent straw. Okay, here we are telling the patient to do the suck. Same, आप आने पकड़ो straw ने, suck, do not fully suck. Okay, मुंह के अंदर नहीं लेना है पानी, आपको सिर्फ रोकना है suck करके, थोड़ा ग्लास नीचे रखो, हाँ, very good. Suck, relax, हाँ, suck. You can see the technique of this sucking and blowing, that is very important by closing the lips on the both the sides of the straw, so the force can be applied in the straw. Yes, now blow. Now you can see the again moving here clearly. થોડુંક નીચે રાખો. યસ, હજી નીચે. યસ, નાખી દો અંદર. ઓકે, હવે બ્લો કરો. યસ, you can see the balloons, air bubbles inside the water. થોડો ગ્લાસ ઊંચો રાખો, આડો આમ રાખો. હા, blow. Yes, you can see the air bubbles. Blow. Yes, blow. Very good. You can see. Yeah, blow. Very good. Slowly, gradually blow in the sustained manner. जितना हो सकता है कंटिन्यूस ब्लो करने की कोशिश करो, धीरे धीरे. हाँ, very good. Relax. When the patient become fatigued, we have to stop. Okay, this blowing and sucking exercise itself develops the coughing and secretion inside the patient mouth. Okay, so next exercise we are going to see is bilateral manual task activities. This was all about these tongue muscles. We also seen the tongue muscles in the exercise. Again, we see one more time. Tongue ko I have put the finger in the tip of the tongue inside the mouth. Okay, and I am asking the patient to force it. हाँ, धक्का मारो मेरे हाथ को, रिलैक्स करो, वापस धक्का मारो, मारो जोर से, मारो जोर से. Yes, you can use this tongue, or you can use things like this type of straw also. Okay, apply the straw over here and tell the patient give the resistance. Yes, for feedback we have to give some object like this, which is very light, not piercing any part of the tongue. Okay, and we have to give resistance to the tongue movement. You can use the straw. You can see very nicely second done this resisted tongue protector exercise. Next, on the side, tongue बाहर निकाल दो, सीधा कर दो tongue को. हाँ, अभी मैं साइड में रख रहा हूँ स्टो, उसको बोलना है साइड में धक्का मारना है स्टो को. यस, साइड में धक्का मारो. वेरी गुड. साइड पुशिंग द स्ट्रो by the tongue means in the tongue side muscles. सेम वे टंग पहले प्रोट्रूड करो, हमको साइड में अप्लाई कर देना है स्ट्रो को. अभी साइड में धक्का मारो. यस, मेरी साइड धक्का मारो स्ट्रो से. वेरी गुड. सो दिस वे यू टू डेवलप. अगेन लास्ट एक्सरसाइज, उनको बस जिप बाहर निकालो. अभी आपको जिप को अंदर की तरफ लेना है, ऊपर की तरफ, ऊपर के लिप को टच करना है. ऊपर के लिप को टच करो, बाहर निकाल के ऊपर के लिप को टच करने की कोशिश करो. You can see these muscles are still weak. Taking the tongue out and touching the upper lip. Yes, touching the upper lip. The folding of the tongue muscles means called tongue flex muscles. Okay, that is also still weak. So we can apply the resistance in this way. Okay, horizontally applying the straw. Okay, now tell the patient to take the tongue up. jaw नीचे ही रखो, सिर्फ टंग को ऊपर करने की कोशिश करो. हाँ, टंग को ऊपर करो. वेरी गुड. टंग को ऊपर करो. हाँ, टंग को ऊपर करो. वेरी गुड. टंग बाहर निकाल दो. यस, अभी ये स्ट्रो दिया है मैंने आपको, स्ट्रो को आपको ऊपर धक्का मारने की कोशिश करो. यस, स्ट्रो को ऊपर धक्का मारने की कोशिश करेंगे, उसके लिए वो टंग को रैप करेंगे, रैप करने की कोशिश करेंगे. वापस टंग बाहर निकालो. ये मैंने अप्लाई कर दिया है स्ट्रो, एग्जैक्टली आप देख सकते हो हॉरिजॉन्टली. अभी उसको बोलना है टंग से स्ट्रो को ऊपर पकड़ने की कोशिश करे या टंग से ऊपर स्ट्रो को धक्का मारे. जॉ से नहीं मारना है. फिर समटाइम्स कंपल्सरी मूवमेंट्स यूज करता है. यस, सिर्फ टंग ऊपर लेने की कोशिश करो. यस, यस, हाँ, यस. सी, टंग एलिवेटर मसल्स दैट आर वीक, मेकिंग दिस graphs also they are weak. We have to develop the strength in that. It will be achieved within short time. Maybe in the next video when we do, okay, this movement would have achieved. Okay, so this exercise we can done for the tongue also or oral muscles. We can also apply the two stroke crossway and give the resistance in the facial muscles and touching the both the sides. Okay, or with the tongue pressing over the cheeks on both the sides. There also movement we can done. We can do the blowing also, or we can make the face in different expressions to develop the tongue muscles. Like this करो. Yes, in very good. Like आपको लिप से ही टंग को रोकना है, खुद की लिप से टंग को रोकना है. मैंने लिप बंद कर दिया. And from the lip I am giving resistance to the tongue muscles. Yes, very good. These are the things we have to teach the patients. Multiple way we can do this oral strengthening exercise. Okay, now we see the last part of that today's bimanual task activities. She has achieved a good level. પગમાં કે કશું લગાવી દો એવું. Okay, fine. Yes. Her right hand is strong. You can see that. ये हाथ ने ऊपर ले जाओ, नीचे करो. Yes. You can see the right hand. Now do the left hand. You can see the left hand weakness. Okay. She is not able to take the hand up on left side, but right side, yes, she can do. Okay. So what we can do? Always have the assistant. It is called dual task activity or bimanual assisted exercise. Bimanual task activities. Always allow the patient to hold by herself. Okay. Applying the stable surface below, because elbow support is very much important during this exercise. If the elbow support is not there, you cannot have the proper movement. Okay, it will be the trick movement. अभी ऊपर ले जाओ, ऊपर हाथ को. अभी नीचे ले जाओ, पूरा नीचे ले जाओ. हाँ. Now take it up. पूरा नीचे, पूरा ऊपर. Now you can see this activity patient doing by herself. So this type of active exercise facilitate the patient confidence. कि मैं तो इतना ऊपर कर रही हूँ, नीचे भी कर रही हूँ. When alone she is not able to do, but with the assistance she can able to do very well. Okay, अभी इसमें आपको क्या करना है? पेशेंट कर रहा है, immediately PNF न्यूरोफिजियो है ना हम लोग, तो हमको कभी वेट नहीं करना है कि वो खुद करे. थोड़ा मूवमेंट आया, कैच इट. कैसे करना है? रेजिस्टेंट. यस, ऊपर लो, ऊपर लो, ऊपर लो, ऊपर लो. हम रेजिस्टेंस कर रहे हैं स्ट्रॉन्गर हैंड की साइड से. आप देख रहे हो, नीचे करो. मैं ये स्ट्रॉन्गर साइड है, उसमें रेजिस्टेंस दे रहा हूँ, तो दैट इरिटेट्स टुवर्ड्स द वीकर साइड, राइट. अभी आप लोग थोड़ा समझ रहे हो न्यूरो प्रिंसिपल्स. बोलो नीचे. थोड़ा भी पेशेंट मूवमेंट कर रहा है, डोंट लीव हर, डोंट लीव हिम. ओके, इमीडिएटली अप्लाई अवर टेक्निक्स, गेट द बेटर स्ट्रेंथ. डोंट हैप्पी विद द लो स्ट्रेंथ. ओके, ऑलवेज बी हैप्पी व्हेन द पेशेंट बिकम्स नॉर्मल. हमको अपना एफर्ट तब तक नहीं छोड़ना है जब तक पेशेंट फुल्ली रिकवर नहीं हो जाता है. You have to keep on trying, keep on efforting every day with the how to come with the new exercises, so patient enjoys it. So it should not be the same boring protocol every day. Okay, has to be changed in different way, but the muscles may be the same. Yes, this type of resisted we have to do. Along with that, you also apply supination and pronation activity, rotating the hand. हाँ, पूरा रोटेट किया, फिर यहाँ से यहाँ रोटेट किया. जब भी चाहिए आप असिस्टेंट भले दे दो, लेकिन डोंट डू पैसिव. पैसिव नेवर हेल्प्स. प्लीज रिमेम्बर दैट थिंग. ओके, वेरी गुड. उसके हमने बहुत सारे ब्रशिंग भी चल रहा है उनका, और टैपिंग भी चल रहा है, यानी फैसिलिटी टेक्निक्स ऑफ द बोबाथ अप्रोच आल्सो गोइंग ऑन इन हर टू फैसिलिटेट द वीक मसल्स. ये सब भी चल रहा है, वेट बेरिंग मूवमेंट्स भी चल रही है. ओके, नाउ नेक्स्ट एंड लास्ट एक्सरसाइज वी मेक हर पेशेंट. ये हो गया अपर लिम्ब का सपोर्टेड. अभी इनको बोलना है यहीं से आपको उठाने की कोशिश करो. It's more difficult, okay, but we have to make an effort. Try करो, try करो, हाँ try करो, try करो. Yes. Again, this exercise uses the very large muscles of the shoulder, so this may be strenuous. Okay, तो आपको slowly करना है और पेशेंट्स के पैरामीटर के साथ ही करना है, वाइटल पैरामीटर्स के साथ, और slowly करना है. जो भी लार्ज मसल्स यूज कर रहे हैं उसमें समझने का आपको थोड़ा असिस्टेंस भी देना है और थोड़े काउंट्स कम करने हैं. ठीक है, धीरे धीरे उठाओ, उठाओ. Yes, very good. Because next our target is to achieve this shoulder flexion. So अभी से उनको असिस्टेड रेंज में करेंगे. पेशेंट एफर्ट तो कर ही सकता है, भले एक्टिवली अगेंस्ट ग्रेविटी फुल रेंज पे नहीं जा सकता, लेकिन शी इज एफर्टिंग वेरी वेल. तो एफर्ट्स को हमको यूज कर लेना है ट्रीटमेंट में. हमने बताया था डोंट लीव, पीएनएफ यूज करो. क्या करेंगे? शोल्डर फ्लेक्शन में वीक है, नो प्रॉब्लम, यहाँ होल्ड कर दिया, होल्ड किया. अभी बोला कि अभी नीचे ले जाओ, रिवर्स भी करो. रिवर्स में सी कैन अप्लाई गुड स्ट्रेंथ, तो उसमें रेजिस्ट करो. रिवर्स में सी इज अप्लाइंग गुड स्ट्रेंथ. या टेक इट डाउन, 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 डाउन. यस, वेरी गुड. गोइंग अप, असिस्टेंस. Yes, take it down, 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 down. You can see she is resisting, and for doing the shoulder extension, she is also using the adductor muscles of the shoulder. Yes, you can see she is also doing the adduction of the shoulder to go for the shoulder extension. Yeah, come up. Always patient uses this. See, for going shoulder flexion, she is using shoulder abductors. Have you seen this? Okay, while going down, resisting, she is using shoulder adductors. You can see this is a multi-combination exercise. Yes, again one more time. Going up, she is using along with the shoulder flexor are weak, therefore she is using compensation with the shoulder abductors. You've seen that. Okay, both elbows are going out and going down. Okay, when applying resistance, he's using shoulder adductor to compensate with the shoulder extensor weakness. Yes, we have to allow that. Okay, to strengthen that muscles for getting the stability in the proximal sides. Okay, so these are the all exercises. There are multiple variants of this. We have done the exercise in different way. Another way, it is दोनों एल्बो साथ में रख दिया, उनको बोलना है साइड में आपको झुकना है, इस साइड से आपको इस साइड झुकना है. यस, अभी इस साइड झुको, उठाओ एल्बो, टर्न. यस, अभी यहाँ एल्बो फिक्स रखो, इसको उठा के उस साइड ले जाओ. यस, इसे कॉल इंडिविजुअल shoulder rotator exercise with the assistance, and where she can apply, where she can do well, we can give the resistance. So ये एक्सरसाइज भी हमको इंडिविजुअल हैंड पे कर सकते हैं, लेकिन देखा आपने सब एक्सरसाइज कैसे कर रहे हैं, क्लास्पिंग द हैंड से कर रहे हैं. सो पेशेंट डज नॉट लीव द कॉन्फिडेंस. अगर सिंगल हैंड से करना चाहेंगे पेशेंट नहीं कर पाएगा, तो पेशेंट कॉन्फिडेंस लॉस हो जाएगा. राइट, तो ये सब हमको विथ कॉन्फिडेंस करने के लिए क्लास्पिंग किया है. फाइन, अभी नेक्स्ट एक्सरसाइज करेंगे, बहुत अच्छी, उनको बिठाएंगे. अभी देखो हम कैसे बिठा रहे हैं, हम सिस्टर मिलके. यस, ओके, ये सब नीचे ले लिया, सब पिलो हमने हटा दिए. ओके सिस्टर, तो मैं यहाँ आ जाऊँ. ऑलवेज थेरापिस्ट शुड बी एट द साइड ऑफ द पेशेंट वेयर वी हैव टू मेक हिम सिट. मुझे हमको इस साइड बिठाना है, बिकॉज यहाँ वेंटिलेटर के पैरामीटर्स है, तो हमको यहाँ बिठाना है. तो हम उसी साइड पे पेशेंट को मूव करेंगे, यानी कोई लीड्स भी कुछ खींचे नहीं. ओके, अभी धीरे से देखो हम कैसे बिठा रहे हैं. बहुत टेक्निक बहुत इंपॉर्टेंट है. उनके लोअर लिम्ब की मूवमेंट अच्छी है, तो पेशेंट खुद ही अपने पाँव बाहर ले लेगी. ओके, अभी मुझे देखो क्या करना है, मुझे ऑलवेज उनको सपोर्ट करना है प्रॉक्सिमल पार्ट से, यानी ट्रंक से. आप देख सकते हैं मेरा हाथ कहाँ है, मेरा हाथ है उनके ऑपोजिट शोल्डर पे. मेरा हाथ ऑपोजिट शोल्डर पे, मेरे फोरा में उसका नेक का सपोर्ट है. ओके, यस, अभी उसको पाँव दोनों बाहर ले लिया, और पीछे वाले जो है उनको टंग से सपोर्ट करेंगे. वी टू टेक केयर ऑफ ऑल दिस पाइप्स. जैसे हमारा राइस ट्यूब है, ईटी ट्यूब है, वो सबका भी हमको ध्यान रख के करना है. सबलिंगुअल ट्यूब है, ये सबका भी ध्यान रख के हमको करना है. हाथ में सिरिंज भी है, तो ये सब चीज़ों का ध्यान रख के ही हमको कोई भी मूवमेंट करानी है. तो नथिंग शुड गेट पुल आउट. ओके, ये बैठ गए पेशेंट, धीरे से ये नीचे कर दो. पूरा इसको हम फ्लैट कर देंगे, पेशेंट अपना हाथ का सपोर्ट दे पाए इसलिए. यस, आपने देखा मैंने ये हाथ कैसे रखा है, यहाँ आप देख सकते हो. आंगड़ी उठाओ, आंगड़ी में लगावे दो. Yes. Okay. Yes, we have seen the parameters also. Respirate थोड़ा हाई हो गए, अभी थोड़ा 2 मिनट रुकेंगे. हार्ट रेट थोड़ा SpO2 बराबर है. पेशेंट को बिठा दिया, आप देख सकते हो इसमें सिरिंज है, इसलिए पेशेंट का हाथ इधर रखा है, लेकिन तो भी हमको इसको थोड़ा पास से वेट बेरिंग पे रखना है. ये हाथ उनका फुल वेट बेरिंग पे है, और इसके वेट देना है आपको. वेट दो बेटा. यस, धीरे धीरे हल्का वेट दो. ये हाथ भी बराबर है, पेन नहीं है, कंफर्टेबल. ओके, पाँव अलग रखना है. अभी देखो उसमें इसमें कैसे मूवमेंट करा रहे, उनको बोलना है पीछे से जो है असिस्टेंस हमने लिया है वो सपोर्ट कर रहे हैं, आप सपोर्ट छोड़ दो. यस, यू कैन सी राउंड लेके आप देख सकते हो पेशेंट कैसे इंडिपेंडेंटली बैठा है. सी एस डेवलप द पार्शियल ट्रंक कंट्रोल. पार्शियल ट्रंक कंट्रोल उसने ऑलरेडी डेवलप कर चुकी है. There is no support given on the back. There is another bigger achievement we have received in last 10 days. Okay, in last video she was not able to sit any seconds without support. Now you can see in the only 1 week of our effort, we have made her sit without support. Okay, with partial assistance of the hand. Okay, this is not assistance, it's a very light assistance. Okay, this hand is not at all giving any weight, and she is maintaining her balance alone. It's a very big achievement. Okay, in very few days, only 1 week of time she has achieved this due to her effort and positivity inside and cooperation to us. And definitely we have done, physios always works better. Okay, ऐसे पेशेंट में फिजियो ही सबसे ज्यादा काम करते हैं. मेडिसिन only supporting, physios only developing this improvement. Okay, so be proud to be a physio. नेक्स्ट एक्सरसाइज, इसमें बैठ के क्या करना है, अभी पाँव एक सिंगल उनको बोला उठाओ। देखो जब ये पाँव उठाएगी तब उनका हो सकता है बैलेंस बिगड़ सकता है, इसलिए आपको एक सेफ्टी के साथ किसी को रखना है, नॉट फॉर सपोर्ट। ओके, जब भी ये पाँव की मूवमेंट करेगी अगेन ट्रंक विल गिव द चैलेंज, टंग का बैलेंस को चैलेंज मिलेगी, क्योंकि पाँव को उठा के साथ साथ टंग का बैलेंस भी मेंटेन करना है। उठाओ, रख दो नीचे, वापस उठाओ, कोशिश करो। ये लेफ्ट साइड है, आप देख सकते हो लेफ्ट साइड का वीकनेस है ही, अपर लिम लोअर लिम और फेस इवन ट्रंक में भी लेफ्ट साइड इज मोर वीकर देन राइट। अभी राइट उठाओ, यस उठाओ, वेरी गुड। और जितना हो सके उतना पेशेंट को क्या करना है, जो भी मूवमेंट कराओ उसमें बोल रहे हैं उनको आपको होल्ड करना है, होल्ड करना है, जितना ज्यादा सेकंड होल्ड करो उतना भी, इतनी रेंज उनकी अवेलेबल है तो सेम रेंज में आप रेजिस्टेंस अप्लाई करो। अब करो, अवेलेबल रेंज में रेजिस्टेंस करो, यस ओके, सेम वे हियर, इतना रेंज हो रहा है एक्टिवली, नो प्रॉब्लम, उसी रेंज में हम थोड़ा रेजिस्ट करेंगे, माय रेजिस्टेंस, डोंट फॉरगेट द पीएनएफ। सेम वे उनका हमने अपर ले लिया, ऊपर लिया है, यहाँ से उनको बोलेंगे आपको नीचे ले जाओ, नीचे ले जाओ। Yes, you can see reverse muscles are very strong. So we have to give resistance in the knee flexion pattern also. Both side. नीचे ले जाओ. Yes. Don't leave any strong muscles alone. Strong muscles का तो स्ट्रेंथ को यूज करना ही है. Yes. देखो मैं जब नी फ्लेक्शन को स्ट्रेंथन कर रहा हूँ, देखो आप देख सकते हो जैसे एंकल डोर्सिफ्लेक्शन कैसे डेवलप हो रहा है. ये नॉर्मल है फुट. मैं ऊपर लिया, अभी उनको बोलोगे नी फ्लेक्शन करो. देखो. Have you seen this? फुट डोर्सिफ्लेक्शन कैसे इंप्रूव हो रहा है, नीचे करो, यस रिलैक्स, नॉर्मल देखो कैसा है फुट, ओके। नी फ्लेक्सर की स्ट्रेंथनिंग के साथ साथ आप डोर्सिफ्लेक्सर भी ऑटोमेटिक फैसिलिटेट हो रहे हैं, ओके, दैट इज आल्सो टेक्निक ऑफ पीएनएफ। तो दोनों फुट को भी डोर्सिफ्लेक्सर को स्ट्रेंथन करना है, बिकॉज फुट इज वेरी कॉमन इन जीबीएस पेशेंट, डिस्टल वीकनेस, ओके। तो उसको हम डेवलप करने के लिए ये टेक्निक बहुत अच्छा यूज कर सकते हैं। By the way, she does not have that foot muscle weakness as compared to the upper limb, but still leg muscles are not up to 100%. The power is only 2+. Okay, तो उसके हिसाब से हमको इसको स्ट्रेंथन लोअर लिम्ब का भी करना है। लोअर लिम्ब की सब एक्सरसाइज हमने लास्ट वीडियो में देखी थी। अभी नेक्स्ट एक्सरसाइज करना है, हम दोनों का कर लिया, फैसिलिटी भी कर दिया। अभी थोड़ा आगे जाएंगे, दोनों पाँव को एक साथ ऊपर करने की कोशिश करो, होल्ड करो, रिलैक्स। When patient does both the legs together, then it facilitates the abdomen muscles. अब करो, या जब भी पेशेंट बायलेटरल मूवमेंट करेगा तो समझ लो उसका एब्डोमेन का इन्वॉल्वमेंट इसमें है, रिलैक्स। अब करो, यस, इसमें भी रेजिस्ट करना है, अगेन गिव रेजिस्टेंस टू द दिस नी एक्सटेंशंस आल्सो अलोंग विद द एब्डोमेन। तो ये भी याद रखना है कि जब बायलेटर करते हो हियर इज सम इन्वॉल्वमेंट ऑफ ट्रंक एंड एब्डोमेन मसल्स। नेक्स्ट एक्सरसाइज, उसमें भी दोनों का ऊपर किया और दोनों को नीचे साथ में रेजिस्ट करना है, यस। Yeah, that also gives the strengthening of the abdomens. Indirectly ये आप पाँव की strengthening कर रहे हो, पाँव की के साथ साथ abdomen भी strengthen कर रहे हो, relax, सांस लो, normal, हाँ। Next exercise, hip flexion, yes, touching the knee to our hand. This also developed in last week, okay. This movement was not available initially, वो भी उसने बहुत अच्छे से अचीव की है। Same इस side. Very good. This is very important gait pattern. When we walk, we do the hip flexion. Okay, that hip flexion pattern comes when she is doing this activity. Okay, ये activity कर रही है तब उसका hip flexion pattern आ रहा है, ठीक है। तो ये hip flexion pattern है, बहुत important. Relax. अभी उसमें ही same resistance apply करो, mild resistance, अंदर आ गई, mild resistance pattern, yes. Okay, यहाँ से mild resistance pattern. Yes, same way we can do opposite. यहाँ से हाथ रखा, उनको नीचे धक्का मारो, yes. We take the leg up, push down, push down, push down, push down. Yes, same way here, taking the leg up and push down, opposite. This also develops the hip extension strength. Okay, hip extension strength along with the abdomen and trunk remains the same. Yes, this is also very good technique to facilitate the hip extensors that we use in the gait also and when we do the standing. Last exercise in this position, okay, we have to go the core muscle strengthening. How to do? Here you can apply the one hand or you can apply the ball also, but I'm using my hand because I come to know how much patient able to effort. अभी आपको दोनों घुटने के बीच में मेरे हाथ को स्क्वीज करना है। अगर मान लो मैं कुछ पिलो रख देता हूँ बीच में, उसको बोलता हूँ तो आप इस पिलो को दबाओ. ओके, आई विल नॉट कम टू नो how much strength is applying, which side is weaker, which side is strong, where need to be strengthened more. इसलिए जब भी हम थेरापिस्ट पेशेंट के साथ होते हैं तो बेटर यू अप्लाई योर ओन हैंड फॉर रेजिस्टेंस. दबाओ तो हमको पता चलेगा हाँ ये बराबर जोर दे रही है, कम दे रही है. और दबा के क्या करना है, एवरीथिंग रिमेंबर, होल्ड होल्ड होल्ड. आपको दबा के सब चीज होल्ड करना है, सब चीजों में आपको होल्ड करना है. ओके, होल्ड इट, यस, रिलैक्स, होल्ड इट, होल्ड किया, रिलैक्स किया, होल्ड इट. जितनी सेकंड्स होल्ड कर पाए उनको होल्ड करवाओ. रिलैक्स, होल्ड इट, रिलैक्स. सेम ऑपोजिट डायरेक्शन ऑल्सो वी कैन डू. दोनों नी को मैं टच कर दिया है पैसिवली. अभी ओपन करो या बाहर की तरफ फोर्स करो धीरे धीरे. वो भी आपको होल्ड करना है जितनी सेकंड होल्ड कर पाओ. It also strengthens the lateral abdominal, even the hip lateral muscles, abductor muscles. Okay, that gives a strain to that. और जब हमने अंदर स्ट्रेन किया था उसमें उनके यूरिन के प्राइविफॉर्म मसल्स भी आ जाते हैं, एब्डोमेन भी आ जाते हैं और हिप एडक्टर भी आ जाते हैं. ये सब मसल की स्ट्रेंथनिंग आप इस पोजीशन में करा सकते हो. इससे बहुत मल्टीपल वैरायटी ऑफ द मसल्स हैं जो आपने यहाँ स्ट्रेंथन कर रहे हो अभी. ओके, दैट्स वेरी इंपॉर्टेंट एक्सरसाइज. और लास्ट में हम आज करेंगे नया एक्सरसाइज, दोनों क्लास्पिंग करवाएंगे. यस, ओके, थंब ऊपर ले लो, सिरिंज बाहर निकाल लो. ओके, फाइन. अभी इसको ऊपर लेने की कोशिश करो दोनों हाथ से. यस, 100% अगेंस्ट ग्रेविटी एक्टिविटी. यस, नाउ ट्राई टू रीच फॉरवर्ड. यस, देखो ये रीच फॉरवर्ड एक्सरसाइज जो है जो हम ये पोजीशन में कराएंगे उसमें भी बहुत अच्छा एब्डोमिनल कंट्रोल डेवलप होता है. उसमें क्या करना है, पेशेंट को आगे धक्का मारो. यस, पेशेंट आगे फोर्स कर रहा है, उसको मैं यहाँ से रेजिस्ट कर रहा हूँ. आई एम रेजिस्टिंग व्हाइल शी डूइंग दिस फॉरवर्ड मूवमेंट. आप आगे आओ, ट्राई करो, ट्राई करो. यस, आई एम रेजिस्टिंग दिस मूवमेंट. यस, यहाँ से स्टार्ट कर रहे, आगे जाओ 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 जाओ. जब भी हम रेजिस्ट कर रहे ऑटोमेटिकली हर एब्डोमेन कंट्रैक्ट्स अ लॉट. तो वो बहुत अच्छा एब्डोमेन का कोस्ट कंट्रोल देता है. दिस इज द वे हाउ यू डेवलप द एब्डोमेन स्ट्रेंथ इनडायरेक्टली by strengthening, resisting the upper limb and developing the strength of abdominal. Again, pain principle. This is called neurophysio. मारो धक्का जोर से. या सेम वे, ऑपोजिट वे, हमने इधर से पकड़ लिया फुल डायरेक्शन में. अभी उनको बोलना है आपको पास में ले जाना है. ओके, एंड वी आर रेजिस्टिंग फ्रॉम हियर. यस, बिहाइंड द एल्बो, पोस्टीरियर प्रॉक्सिमल पार्ट ऑफ द आर्म. आर्म के पीछे से हम उसको यहाँ रेजिस्ट कर रहे हैं. ओके, यहाँ से. ओके, अभी पीछे ले जाओ. यस, ले जाओ. या रेजिस्टिंग द शोल्डर एक्सटेंशन. यस, ले जाओ, जो लगाओ जो लगाओ. चलो, यहाँ तो मैं इसे सपोर्ट दिया है, मेरा रेजिस्टिंग हैंड ये लेफ्ट वाला है, यहाँ मैं इसे सपोर्ट कर रहा हूँ. अंदर ले जाओ. यस, यहाँ से उनको बोला नीचे ले जाओ, आपकी तरफ ले जाओ. हाँ, ले जाओ. The resisting again develops the very good trunk and abdomen control. This is very important technique of developing the abdomen and trunk control in the patients. The same way आप उनको ऐसे rotations भी करवा सकते हो. यहाँ करवा के अभी आगे reach out करो, पीछे जाओ, वापस आगे reach out करो, पीछे जाओ, वापस आगे reach out करो. यस, अगर पेशेंट कर रहे हैं तो उसमें अगेन जो मैंने बताया रेजिस्टेंस चालू करो. रिवर्स जा रहे तब यहाँ से रेजिस्टेंस दो. आगे जा रहे तो राइट हैंड से, रिवर्स जा रहे तो लेफ्ट हैंड से रेजिस्टेंस करो. क्लियर? सेम भी आप डिफरेंट डायरेक्शन में यूज कर सकते हो. डिफरेंट डायरेक्शन एंड डिफरेंट रेंज. अभी थोड़ा क्रॉस में नीचे. यस, क्रॉस में नीचे. आगे जाओ, धक्का मारो मेरे हाथ को. जब पीछे जाते हो हमको यहाँ से रेजिस्ट करना है. आगे जाओ, मेरे हाथ को धक्का मारो. पीछे जाओ, आपको यहाँ से रेजिस्ट करना है. सेम वे, आगे जाओ, मेरे हाथ को धक्का मारो, पीछे यहाँ से रेजिस्ट करो. धक्का मारो, रेजिस्ट करो. ठीक है. दिस ऑल एक्टिविटीज हेल्प्स टू डेवलप द टंग कंट्रोल वेल. ये बहुत अच्छे से किया, पेशेंट का डेवलप बहुत अच्छा टंग को डेवलप होगा. देखा पेशेंट का पर्सपिरेशन, आप देख सकते हो. हाँ, ये पर्सपिरेशन बता रहा है कि पेशेंट ने कितनी मेहनत की है. ओके, वी शुड क्लैप टू हर फॉर हर एंड वी शुड प्राउड टू बी हर कि शी इज सो मच एफर्टिंग एंड हार्ड वर्किंग टू कम आउट ऑफ दिस सिचुएशन. अनफॉर्चुनेटली ये कोई आया है, लेकिन ये वेरी स्ट्रॉन्ग, शी इज वेरी ब्रेव कि मैं इससे बाहर निकलूंगी और जरूर से नॉर्मल हो जाऊंगी और अपना लाइफ में आगे बढ़ूंगी. यस, Very good. Clap. Yeah, good. Okay. Thank you very much to all to learn something new, and please play for her faster recovery. Thank you.